Well, good morning, and of course we want to welcome everyone, especially on a day that is both hopeful but also sobering here in our community here in Long Beach. We are going today to really begin the rollout of our vaccine program at all of our hospitals and our clinics and our nursing and skilled care facilities. So that brings us a lot of hope. At the same time, we are in a very serious place as it relates to COVID-19, and I want to just give a very brief update as to where things lie here in the city, and then transition into a very exciting a moment for us here in our community. We all know that COVID-19 remains the most serious threat to life here in our state, as well as across the country. The case count in the past month alone has accounted for 42% of all cases in Long Beach since we first started reporting back in March. There have been 311 families in our community that have lost someone to COVID-19. And as you've probably seen and heard in many reports, our regional capacity in Southern California for ICU beds is essentially full. What that means is if you look all across our region from San Diego through Orange County, Los Angeles, and a bit north, we are essentially running out of ICU beds. Now here in Long Beach, our Long Beach area hospital system, of course, is also strained. According to our health department, we have approximately about 10% here left of ICU beds within our system, but that number is dangerously close to being overwhelmed by our other area hospitals that are close to full. And so the total number, when you combine all hospitals across the region, we are essentially close to full, and it really is a crisis across the entire state of California. We're very grateful to the representatives and really friends that are with us today from Memorial Care here at Long Beach Medical Center, Dignity Health, St. Mary Medical Center, and College Medical Center as well. I've gotten to know all of these leaders well throughout this crisis, but most importantly, I've gotten to know so many of the nurses and the medical personnel that come to work as heroes every single day, not knowing what that day will bring, and knowing how difficult the stress of the job has become. I ask everyone, as we continue to stay safe, to keep in mind all of our brave nurses and medical teams that are assisting our families and our friends every single day. It's also not lost on me that we're here at this amazing institution and hospital. And this place is also the location where my mom spent her last few days of her life. And I just want to again thank the incredible heroes that took care of her in her last days. And as a healthcare worker herself, I know she would have been in the front of the line for these vaccines. I also know that she would have been so happy to see her colleagues receiving their vaccinations today and in the days ahead. Pretty soon, you are going to meet Brandon. Now, Brandon, of course, is going to be receiving this vaccine, and soon after Brandon, there is going to be a huge rollout that happens across the city of folks receiving their vaccinations. Now, Brandon has been a RN here at Memorial for 3 years and is currently a lead clinical nurse in the COVID-19 unit. It's actually a unit unfortunately, that I know really well, having spent so much time on the phone with so many of the nurses and getting to know their incredible work that they do every single day. He's always been interested in medicine, and he's always been interested in helping people. So I'm really, really proud of him and his whole team, and we're excited he's going to get the vaccine today. Now, we know that in addition to the 3,900 doses of the Pfizer vaccine, we'll also be receiving about 11,600 doses of the Moderna vaccine just in this week ahead that's coming forward. So we are fully in our vaccination process as of today, and we are excited about the rollout. We will be following all of the CDC protocol as to who gets a vaccine and when. And in this first phase, as a reminder, all of our healthcare workers will be vaccinated first. Everyone from hospital workers to nursing care facilities and their residents and our pharmacists and dentists. Please know that our workplaces will be key places to distribute that information in this very, very first phase. And we'll continue after this phase to move on to essential workers, and those folks will also be notified appropriately. I want to go ahead now and turn this over to someone that's been a really great leader in our community, and that's John Bishop, who of course is the leader of this hospital system, who has some remarks as well. So I'll turn it over to Mr. Bishop.
All right, good morning, and thank you all for being here. I'd like to start by first acknowledging Mayor Garcia, whose steadfast resolve in these absolutely unprecedented times has been invaluable. He's worked tirelessly while undergoing his own grief at the hands of this pandemic. I'd also like to thank the Long Beach Department of Public Health and Dr. Anissa Davis and Kelly Colopy. Your team has shepherded us through this daunting crisis, and we appreciate your support and guidance. I know my colleagues from St. Mary Medical Center and College Medical Center share in my solace that the vaccine is finally here. And it's going to be able to protect our frontline healthcare workers and the rest of the community. Our dedicated doctors, nurses, respiratory therapists, food service workers, and housekeepers, and so many more have stepped up for the betterment of the health of our community. I firmly believe that in times of crisis, you see the best in people, and we have seen that over and over again through this pandemic. Even at the start of the pandemic, when so much was unknown about this virus, our frontline workers were stepping up, asking for extra shifts, asking to be cross-trained to work in the COVID units, and they even sat with patients holding their hands when visitors weren't allowed. They were and continue to be pushed to the brink. They've been working long hours, wearing layers of personal protective equipment, all while concerned for their own health and for the health of their families. I want to commend them and thank them for their commitment and sacrifice. And today, this vaccine and the vaccines to come make me feel very optimistic. There will be many challenging days ahead, but there will be a day when this pandemic is behind us. And those things that we used to take for granted, like gathering with our friends and our family and going to events, all of that will seem that much more special. We aren't through this yet, and so I ask everyone to continue to protect our community's healthcare workers by washing your hands, by wearing a mask, and by social distancing. Today is a significant milestone in our efforts to get to the other side of this pandemic, and we look forward to being able to provide vaccines more broadly in the near future. I couldn't be more proud of my team and in the city in which I live and work. Thank you. And I'd like to invite now Carolyn Caldwell, the CEO of St. Mary Medical Center.
Good morning, and thank you, John. Thank you for inviting St. Mary Medical Center to participate in today's event. I've been so impressed with the collaboration and the leadership from Mayor Garcia, our city leaders, our local health department, and also the leadership of our hospitals here in the Long Beach community. This is such a wonderful time for our community to finally see a light at the end of the tunnel. When there is so much suffering across our community, we are humbled to be a part of the vaccination administration process. When we received our vaccine, there were cheers of joy. We asked our ministers and sisters to bless the vaccine as we prepared to vaccinate our employees and our physicians. Our focus initially is on the frontline workers who are at greater risk. those employees working on the COVID units, in our ICU, and in our emergency department. Our goal is to have all of our employees and physicians at St. Mary Medical Center vaccinated by the end of January or the beginning of February. The vaccine isn't only a positive step for those who work at St. Mary Medical Center, it's also important for their families and for our community. For months now, they have worried about the risk their loved ones have taken and the sacrifice to provide care to our patients. Husbands, wives, sons, and daughters will have a greater peace of mind knowing their loved ones work every day, come to work focused on providing safe, quality care to our patients, are now protected. While there is still a long road ahead of us, there is now greater hope for the future, where COVID no longer takes the lives of the ones that we love. Thank you very much, and I would like to introduce my colleague, Joe Avelina, the CEO of College Medical Center. Thank you.
Thank you, Mayor, and thank you, John and Carolyn. A little bit about College Medical Center. We specialize in behavioral health services as well as detox, although we're an acute care hospital, and truly enjoy the collaboration with St. Mary as well as Long Beach Memorial Medical Center for the higher level of care. First, I would like to extend my gratitude to our healthcare professionals who have sacrificed so much to care for our patients in the Long Beach community. The first batch of vaccines will protect our frontline healthcare workers so they can help our hospitals withstand the current winter COVID-19 wave and save as many lives as possible. While the arrival of vaccine is good news and the light to defeat COVID-19, it does not signal an immediate end to our community's suffering. As physicians, nurses, and hospital leaders, we remain committed in establishing a safe and effective process for administering vaccines to all who are eligible and choose to get vaccinated. The work we do in healthcare is profound, distinguishes us, and the environment is highly complex. But it is the small things we do every day that ultimately defines us. We are encouraged by the progress to fight this virus, and in the evolution of overcoming COVID, we are today somewhere in the path from discovery to innovation. The COVID vaccine holds the promise to alter the course of this pandemic, as I now look forward to the day that this devastating and deadly disease is finally behind us. Without a doubt, healthcare is in the midst of a significant fundamental changes. And while we work through these changes, we cannot lose focus or forget why we choose this sacred and servant profession. Most of all, it's about showing up and giving everything you have to give, especially on the difficult days. As we move forward, we must remember to support each other, to listen to one another, and to remain keen, aware of our shared challenges amidst the industry disruption. I am proud to serve with our healthcare professionals who have been at the forefront of this transformation in the midst of this pandemic. I'm honored to be part of this incredible healing legacy. Thank you, stay safe, and happy holidays.
Thank you, everyone. And now is the moment we've been waiting for. We are going to administer one of the first vaccines here in Long Beach. Go ahead. All right. Good morning, everyone. I'm Jennifer Rice Epstein, Public Affairs Specialist with the City of Long Beach. I'll be reading questions from the media. First, Brandon, congratulations. Tell us how you're feeling.
I'm just honestly, I'm so honored and humbled to be here and be chosen. Oh, sorry. Hello, is this better? Okay. I was just saying, I feel so honored and humbled to be chosen to receive the vaccine. I'm so very excited, and honestly, it didn't even bother me. It was just another vaccine.
We have two questions for you. They come from Haley Mungia at the Press Telegram. First, what have your experiences being on the front lines of treating COVID-19 been like? And how do you use these experiences to inform how you feel about being the first person in Long Beach, or one of the first, to receive the vaccine?
Just coming in every day, working beside my coworkers, nurses, aides, therapists, doctors. And seeing their faces as we treat these patients as best we can. We, as has been mentioned, we've definitely felt the strain, but we just continue to do what we need to do every day in order to provide the best care we can for our patients. And hopefully one day, now that this vaccine is here, we can start to move forward and look towards an end.
And her second question, do you have a message for people who may be hesitant to receive the vaccine?
I would say, if you are having doubts or you are hesitant, please talk to, please talk to your provider, talk to friends, talk to family, and look into yourself and see if this is the thing that you need to do. For me personally, I want to do this to protect my friends, my family, myself, but also to be able to protect my patients and those who can't receive the vaccine, that don't have the choice or option to receive it. But really, honestly, if we are going to get through this, we all need to come together and do our own part. If that means staying home, wearing your mask properly over your nose and your mouth, washing your hands, not gathering, and just being safe, so we can all hopefully get through this together.
Now we'll ask some questions of our hospital administrators. The first questions are for John Bishop, CEO of Long Beach Memorial Medical Center. All right, these first three questions are for Kelly Puente of the Long Beach Post. Approximately how many workers will be vaccinated here at LBMMC?
We received 975 doses of the Pfizer vaccine for each hospital, and we're in the process. We began early this morning, and so 1,950 doses are available today, and we expect to have all of those used in the next few days.
That was her next question. The next few days, that's fantastic. And then how did you decide which healthcare workers were going to be receiving the vaccine first?
We place priority on the nurses and the physicians and any healthcare worker who came into contact with COVID patients. And fortunately, the allotment that we received will enable us to achieve that.
All right, and then the next questions are from Haley at the Press Telegram. Well, she asked how many vaccines your hospital has received, and will all the doses be used in one go, or will half be saved as second doses?
The way that the dissemination is working is that you receive your initial allotment, and the government is withholding the same exact amount to send to you in the 21 or 28 days, depending upon the vaccine.
Thank you very much. Our next questions are for Carolyn Caldwell, President and CEO of Dignity Health at St. Mary Medical Center. Okay, these first questions are from Haley at the Press Telegram. First up, how many vaccines has your hospital received?
Our facility also received 975 doses of the Pfizer vaccine.
Thank you. In some places, hospital cleaning staff will be among the first to get the vaccine. Is that the case at Long Beach hospitals?
Yes, our EVS employees are included in that list of employees who are the first to receive the vaccine. And actually, we have several that are signed up to receive the vaccine today.
Thank you. Are hospitals dividing staff into subgroups within the tiers that are already in place to help with scheduling? If so, what do those subgroups look like?
Absolutely. And so our first priority was to focus on our high-risk employees and physicians that worked in those high-risk areas, and then also the support staff like EVS and food and nutritional service. And that is the process that we utilize, and those employees were notified to sign up and register for the vaccine.
Thank you. The one last question we have is from Kelly at Long Beach Post. The last question for you. How long will it take to distribute that first round of Pfizer vaccines?
So we started this morning at 6 a.m. and we anticipate, based on the number of employees and physicians who have signed up, that we should get through those vaccines in the next few days, and then we will get our next shipment next week.
So much. Now we have a few questions for Joe Avelina, the CEO of College Medical Center. All right, these first questions are from Haley at the Press Telegram. How many vaccines has College received?
Just like John and Carolyn, we also received 975 vaccines.
When is the second delivery expected, and how many doses will it include? And who will receive those next vaccines?
No official word, but we anticipate to receive it about 3 to 4 weeks, the second dosage. But along with John and Carolyn, we'll also, not only the nurses and the physicians, but we've also had the opportunity to vaccinate, or will vaccinate as well, the EVS staff and Food and Dietary Services Security, who's also out there in the front line as well.
Thank you. And then from Kelly at the Long Beach Post, how long will it take to distribute the first round of Pfizer vaccines?
Just speaking with my team, approximately about a week and a half. We also have a Hawthorne campus less than 15 miles from here, 64 beds, so I have approximately about another 150 plus employees to vaccinate in that facility as well.
Thank you.
Thank you.
We will now welcome Mayor Garcia back up, and he will make remarks in Spanish.
Buen día, estamos acá hoy día en un día que sabemos que es un momento difícil para la comunidad, pero también un día que estamos acá en los hospitales que nos da bastante amor porque vamos a estar con las vacunas acá a empezar a nuestros enfermeros, enfermeras y doctores a darles esta vacuna. Acá estamos en el hospital de Long Beach Memorial Care y también con amigos y amigas de St. Mary Medical Center y College Hospital. Es un día muy emocionante. Las primeras vacunas de COVID-19 van a estar acá en esta ciudad hoy día. Hemos estado esperando este momento y es un momento también personal para todos nosotros en esta comunidad. Los trabajadores de la salud son héroes en esta ciudad y por todo el estado de California. Sabemos que ellos van a ser la primera gente que van a recibir esta vacuna y están en esta pandemia trabajando tan duro para nuestra comunidad y para nuestro estado. Este momento es un momento importante para nuestras familias. Yo también entiendo que nuestras comunidades, especialmente la comunidad latina, tienen que entender que estas vacunas son seguras. Es importante que cuando es tiempo para que puedas tomar esta vacuna, por favor, te la tomas. Mi mamá trabajó en la clínica para 25 años y ella pasó de COVID-19 en este mismo hospital, y ella hubiera sido una de las primeras personas a recibir esta vacuna, pero yo sé que a ella le hubiera dado bastante orgullo y también ella hubiera estado emocionalmente feliz que gente en este hospital y en otros también hubieran recibido esta vacuna. El señor que va a agarrar esta vacuna primera se llama Brandon y está acá con nosotros hoy día. Y él ha trabajado en este hospital para 3 años y es un enfermero acá. Sabemos también que en este momento de COVID-19 es un momento bien difícil. Todavía hemos perdido gente en esta ciudad, más de 300 familias han perdido a alguien acá en esta ciudad. Y es algo bien difícil que está pasando todos los días. Por favor, póngase la máscara. No en esta Navidad, no se junten con tu familia. Y estos hospitales necesitan nuestro apoyo. Muchas gracias.
All right, thank you so much, everyone, for being here. And let's give one last round of applause for our healthcare workers.